If you walk every single morning because someone told you it is good for your blood vessels, how sure are you that walking is actually the fastest way to improve blood flow in a body over 60? Most people pause right there because the truth is, walking is good, but it is not the most efficient lever available to you, and almost nobody has explained the one that is. Quick note before we go further. This is general health education, not medical advice, and I am not your doctor. Never start, stop, or change anything based on a video. Always check with your own doctor first. With that said, let me walk you through a daily habit that takes about 5 minutes that researchers have measured directly against exercise programs like walking, and that, in the people studied, moved the numbers that matter for blood flow even further than a months-long walking routine did. Stay with me, because the mechanism behind this is something almost no one in primary care has time to explain in a 12-minute visit, and by the end you will understand exactly why it works, exactly how to start, and exactly what to ask your doctor before you do. Here is the distinction that matters before we go any further, because these two things get confused constantly. Walking is what is called aerobic exercise. It raises your heart rate, it works your big leg muscles, and over months it absolutely helps your cardiovascular system. Nobody in this video is telling you to stop walking. But there is a second, completely different kind of training that works on your blood vessels through a different door entirely, and it has nothing to do with your legs. It is called Inspiratory Muscle Strength Training, and the simplest way to understand it is this. It is strength training for the muscles you use to breathe in. Think of your diaphragm and the muscles around your ribs the same way you would think of any other muscle in your body, like the muscles in your arm. If you do resistance work against that muscle, pushing it against pressure, the same way you would push against a weight, that muscle gets stronger. And it turns out that when you strengthen the muscles of your breath specifically, your blood vessels respond in a way that nobody fully expected. Here is the part that almost no one explains, so let me slow down. Picture the inner lining of your blood vessels. Doctors call it the endothelium, as the inside surface of a long branching pipe system that runs through your entire body, carrying blood to your brain, your heart, your kidneys, every organ you have. That inner lining is not just a passive tube. It is alive, and it constantly releases a molecule called nitric oxide, which tells the blood vessel to relax and widen, the way a pipe might flex open to let more water through with less pressure. When that lining is healthy, your blood vessels widen on demand, blood flows easily, and your blood pressure stays in a comfortable range. When that lining is under strain from age, from inactivity, from years of stiffening, it releases less nitric oxide, the vessel stays tighter, and blood has to push through a narrower, stiffer pipe. That is the mechanism behind a huge amount of what we call cardiovascular aging. And the surprising discovery is that strengthening your breathing muscles appears to directly improve how well that inner lining works, improving what researchers measure as flow-mediated dilation, which is essentially a direct test of how well your blood vessels widen and let blood flow through. Let me give you the actual research, because in this niche I never want you taking my word for something I cannot point you to. Researchers at the University of Colorado Boulder supposedly studying healthy older adults, ages roughly 50 to 80, who had below average blood vessel function for their age, put a group through 6 weeks of this inspiratory muscle strength training, about 5 minutes a day, using a small handheld device you breathe in against, set to a high resistance. After 6 weeks, the study found roughly a 45% improvement in flow-mediated dilation, the direct marker of blood vessel widening and blood flow function. To put that in context, the researchers and outside cardiologists who reviewed the work noted that an improvement of that size in that marker is comparable to, and in this particular study sample exceeded, what is typically seen after months of regular aerobic exercise training, like a structured walking or jogging program, in a similar population. The study was published in the journal Hypertension from the American Heart Association in 2021, led by researcher Daniel Craighead, working in the lab of Doug Seals. I want to be precise with you here, the way every honest source should be. This was one well-conducted clinical trial in a specific population of older adults with below-average vascular function, not a 1,000-person mega trial. And as with any single study, Larger and longer studies help confirm how durable and how universal the effect is. But it was a randomized, sham-controlled trial, meaning one group did the real training and another group did a low-resistance fake version, so the researchers could isolate the true effect, and it was published in a serious, peer-reviewed cardiovascular journal. That is about as solid as evidence gets before you call something settled science. And it is precisely why this habit deserves your attention, even though almost nobody has told you about it. Now let me walk you through what is actually happening in your body, beat by beat, because understanding the why is what makes a habit stick. When you breathe in against resistance through a small spring-loaded handheld device, the muscles of your diaphragm and rib cage have to contract much harder than they do during normal breathing. That is the strength training stimulus, the same basic principle as lifting a weight. Researchers believe that effort triggers a cascade. It appears to increase production of nitric oxide and reduce oxidative stress and inflammation in the cells that line your blood vessels. The same endothelial lining we talked about a moment ago. Over repeated daily sessions, that lining appears to get measurably better at doing its job, which is opening blood vessels on demand so blood can flow where it needs to go, more easily and at a lower pressure. There is also a second, separate effect worth understanding. In follow-up research from the same research group, this kind of breathing muscle training was associated with meaningful reductions in resting systolic blood pressure. In the original trial, an average drop of around 9 points, which researchers noted is a similar magnitude to what some blood pressure medications produce. Though of course, this should never replace a prescribed medication without your doctor's involvement. Two distinct findings in two related strands of research, both pointing toward the same conclusion. Training your breathing muscles trains your blood vessels. Consider someone like Margaret, a composite picture built from the kind of person this research describes, not a real patient of mine, because I am not a doctor and this is not my practice, but a representative, illustrative example of the population studied. Margaret is 68. She walks most mornings, she eats reasonably well, and on paper, her numbers are unremarkable, but creeping in the wrong direction. Blood pressure hovering at the edge of where her doctor wants it, energy a little lower than it used to be, especially climbing stairs. She is not sick. She is simply experiencing what researchers call vascular aging, the slow stiffening of blood vessels that happens to nearly everyone over time, walking habit or not. In a scenario built directly from what this research describes, a person like Margaret adds 5 minutes of inspiratory muscle strength training to her morning, alongside her walk, not instead of it. Within weeks, the kind of improvement documented in the trial, better blood vessel widening, modestly lower blood pressure, is the kind of change her own doctor could track on a follow-up visit. That is the entire promise of this habit, not a replacement for movement, but a second, almost effortless lever sitting right next to it, one that works through your breath instead of your legs. Let me also be completely transparent about the boundaries of what we know, because that honesty is the whole reason I am telling you about a 5-minute breathing exercise instead of something flashier. This research is strongest in adults who started with below-average blood vessel function for their age, which statistically describes a very large share of people over 50. It has been studied over 6 to 12 weeks, with continued benefit reported with ongoing use in follow-up work from the same lab, but it is not yet studied across decades the way walking has been studied. The device used in these trials is a specific, calibrated, adjustable resistance handheld trainer, not a random breathing exercise app, and the resistance was set at a meaningful percentage of each person's own maximum inspiratory strength, individually calibrated, not a generic setting, and critically, this is not appropriate for everyone. Anyone with significant lung disease, a recent heart event, uncontrolled high blood pressure, or any breathing-related medical condition needs to talk to their doctor before starting something like this, because breathing against resistance is by definition for placing a load on your respiratory system, and that needs medical clearance in those situations the same way starting any new exercise would. So here is how this actually works in practice, described as education, not as a prescription, because the specifics of any program should be confirmed with your own doctor or pulmonary rehabilitation specialist. The trials used a small palm-sized handheld device with an adjustable valve, available without a prescription in most places, often used originally in pulmonary rehabilitation settings for people recovering from lung conditions, now also studied for this vascular benefit in otherwise healthy older adults. You breathe in sharply and fully against the resistance, then exhale normally. Researchers describe it as 30 breaths, roughly 5 to 7 minutes, once a day. The resistance is generally set high enough that it feels like real effort by the last few breaths, similar to the last few repetitions of a strength exercise. In the published trials, 6 weeks was enough to see meaningful change, with the research group's follow-up work suggesting the benefit is maintained with continued use and may fade if the habit stops, the same way muscle strength fades when you stop training it. None of this replaces movement, cardiovascular checkups, or any medication your doctor has prescribed. Think of it as an addition that takes less time than brushing your teeth, sitting right alongside your walk, not in place of it. I also want to address the comparison head-on, because the title of this video makes a direct claim, and you deserve the receipts. Walking is one of the best studied, safest, most broadly beneficial habits in all of medicine. It helps blood vessels, but it also helps your bones, your muscles, your mood, your blood sugar, your balance, and your risk of falls. And nothing in this video is suggesting you trade it for 5 minutes of breathing exercises. What the research actually shows is narrower and, frankly, more useful than a simple "this beats that" headline. In the specific direct measurement of flow-mediated dilation, how well your blood vessels widen, the magnitude of improvement after 6 weeks of this breathing training matched or exceeded what is typically reported after similar length aerobic exercise programs in comparable populations of older adults. That is a real, citable, peer-reviewed finding. It is not a claim that breathing replaces walking as a complete health habit, because walking does dozens of things breathing training does not touch. It is a claim that if your specific goal is blood vessel function and your specific constraint is time, here is a second tool, backed by real data, that belongs next to your walk rather than competing with it. Now let's go a layer deeper, because blood flow is not just one single number, it shows up differently depending on which part of your body we are talking about. And the research on this habit touches more than just your arm or your blood pressure cuff. Start with your brain. Blood flow to the brain depends on the same vessel widening mechanism we have been discussing, and reduced blood flow to the brain over years is one of the quiet contributors to the kind of cognitive slowing many people simply accept as normal aging. Here is the mechanism in plain terms. Your brain has almost no ability to store its own fuel, so it depends on a constant, well-regulated supply of blood, moment to moment, delivered through vessels that need to widen and narrow on demand the same way the vessels in your arm do. Picture it like a city's water system during a heat wave. If the pipes cannot flex open when demand spikes, certain neighborhoods get a weaker supply right when they need it most. Early research following the same Colorado research group has looked at whether improving vascular function through this kind of breathing training also shows up in markers connected to brain blood flow and cognitive performance in older adults. With encouraging but still early signals, this is a newer, smaller body of evidence than the blood pressure findings, so I want to be honest that it is promising rather than settled. Consider someone like Robert, a composite picture again, not a real patient, a man in his early 70s who noticed it took him longer to find words mid-conversation than it used to. That kind of change is common, and it has many possible causes, most of them not dangerous, but it is also exactly the kind of subtle shift that researchers connect to declining vascular flexibility over time. The safe action here is not to self-diagnose anything from a video. If you or someone you love notices a real change in memory or word finding, that conversation belongs with a doctor who can look at the full picture: sleep, medications, thyroid function, vascular health, and more, rather than assuming it is just blood flow. Second layer, exercise tolerance, meaning how winded you get doing ordinary things like climbing a flight of stairs or carrying groceries in from the car. This connects back to the same vessel widening mechanism, because better blood flow means your muscles get oxygen more efficiently during effort, which translates into feeling less out of breath for the same activity. In the original Colorado trial, and in related follow-up work from the same lab, participants reported measurable improvements in markers connected to exercise capacity alongside the vascular changes even though the training itself involved no leg movement whatsoever, which is precisely the part researchers found most interesting because it suggests the benefit is coming from the blood vessels themselves widening more efficiently, not from any change in muscle conditioning. Consider someone like Walter, another composite, illustrative picture, a man who used to walk his neighborhood loop without a second thought, who now finds himself pausing at the same hill he never used to notice. That pause is not automatically a crisis. It is exactly the kind of ordinary change that deserves a calm conversation with a doctor rather than panic, because dozens of things, from deconditioning to medication side effects to something more serious, can cause it, and only a doctor can sort out which one applies to a specific person. The honest, non-alarming takeaway is this. If breathing muscle training improves vascular flow the way the trials suggest, one plausible benefit is that ordinary activities may start to feel a little less effortful over time. But that is a secondary observation from the research, not its primary, most rigorously established finding, which remains the direct vessel widening measurement we covered earlier. Third layer, and this one is worth knowing simply because almost nobody mentions it, nighttime blood pressure. Your blood pressure is not supposed to stay flat around the clock. In a healthy pattern, it normally dips somewhat overnight while you sleep, a pattern doctors call nocturnal dipping. People whose blood pressure fails to dip properly at night are, in research terms, associated with somewhat higher cardiovascular risk over time, compared with people who maintain a normal dipping pattern independent of their daytime numbers. Some of the same research lineage studying breathing muscle training has measured effects on 24-hour blood pressure patterns, not just a single daytime reading, because a single number taken at a doctor's office is only ever a snapshot. This is a newer and smaller area of the research than the headline flow-mediated dilation finding, so treat it as an interesting thread to ask your doctor about, not a settled conclusion to build a routine around on its own. If you wear a home blood pressure monitor and have ever noticed your evening or morning numbers behaving differently than you expected, that is useful information to bring to your doctor directly. They may suggest 24-hour monitoring to get the full picture, which a video can never replace. Let me answer the 3 questions I imagine you are already asking, because I would be asking them too. First, does it matter what time of day you do this? The published trials simply asked participants to do it once daily and did not find a specific time of day to be essential. Consistency mattered far more than timing, so pick a time you will actually stick to, often right alongside an existing habit like brushing your teeth or having your morning coffee. Second, do you need the exact device used in the trials? The research was conducted with a specific calibrated, adjustable resistance handheld trainer, and the resistance level was individually set as a percentage of each person's own measured breathing strength. This is not the same as a generic breathing app on your phone, so if you bring this to your doctor or a pulmonary rehabilitation specialist, that calibration detail is worth asking about directly. Third, how long before you would expect to notice anything? The published trial measured its primary results at 6 weeks, with the research group's related work suggesting continued benefit with continued use beyond that point. This is a habit measured in weeks, not days, the same patience any real strength training program requires. Let's talk about who should be especially interested in this and who should slow down and loop in their doctor before trying it. If you are someone whose blood pressure runs a little high despite your best efforts with diet and movement, if you find walking long distances harder than it used to be, or Toster has ever mentioned anything about your vascular age or arterial stiffness at a checkup, this is exactly the population the research was built around, and it is worth a conversation at your next visit. On the other hand, if you have been told you have COPD, pulmonary hypertension, a recent heart attack or heart surgery, uncontrolled blood pressure, or any condition affecting your lungs or breathing, this is precisely the moment to bring the idea to your doctor first, rather than starting on your own, because breathing against resistance changes the pressure inside your chest. And that needs to be cleared for your specific situation. This is not a scary list designed to frighten you away. It is simply honest medicine, the same caution your doctor would apply to starting any new form of exercise. Before we close, here is the recap, because I want you walking away from this with something concrete you can act on, not just an interesting fact you forget by dinner. 1. Walking remains one of the best whole-body habits you can keep, and nothing here replaces it. 2. a separate 5-minute daily habit, training the muscles you use to breathe in against resistance, has been shown in a peer-reviewed, sham-controlled clinical trial to improve blood vessel widening, the direct, measurable marker of blood flow, by an amount that matched or exceeded months of aerobic exercise in a comparable group of older adults, alongside meaningful average reductions in resting blood pressure. 3. The mechanism is your blood vessel lining producing more of the molecule that tells vessels to relax and open, the same lining that naturally stiffens with age. 4. This is not appropriate for everyone, especially anyone with lung disease, recent heart events, or uncontrolled blood pressure, and it absolutely requires a conversation with your doctor before you start, the same as any new exercise habit. And 5. If you do get the green light, the habit itself takes less time than your morning coffee. If this kind of explanation, the actual why behind something, not just a headline, is useful to you, type the words blood flow in the comments below. It helps me know which topics to dig into next, and I do read every one of them. And before you go, tell me this. Which of these 2 habits do you already have in your routine? Walking, breathing training, or neither? Your answer in the comments might be exactly what helps the next person reading decide where to start. One more thing, because it matters more than anything else in this video, never start a new breathing exercise, change a medication, or adjust your activity level based on a video alone. Bring this exact research to your doctor. The Hypertension Journal study from the University of Colorado, 2021, and ask whether it makes sense for you specifically, given your own health history. That conversation, not this video, is what turns interesting research into a safe decision for your body. If you want to understand the other side of this same blood vessel story, what is quietly stiffening your arteries that has nothing to do with diet or exercise at all? That is exactly what we cover next. And it might be the most overlooked piece of this entire picture. I will see you there.